So, beyond some of those more financial incentives for dentists, what practice models or staffing models are you seeing really resonate with dentists today?
I can start with that. I'll talk a little bit about practice models. Some things that we're hearing and some things that our dentists ask about. Does the clinic include this or that? Teledentistry can be one component, but digital dentistry is playing an even bigger role, right? Scanners, digital radiography, it creates faster, more accurate, sometimes same day restorations and treatment planning. AI, we can't get away from AI, and AI plays a big role in this industry as well. AI powered diagnostics. So it's integrated into practices for tasks like analyzing x rays, identifying potential issues earlier, and assisting with that treatment planning. And something we've seen for a while, but still continues to play a big role, is 3D printing. So creation of dental models, surgical guides, aligners, certain restorations that can play a role. But when we shift over to staffing models, right, you've got your dentist, you've got your hygienist, dental assistants, your office staff. One thing we're hearing more about is the addition to the staffing model of dental therapists. So, what is a dental therapist? Licensed health professional. They work under the supervision of the dentist and can provide a wide range of preventative and restorative dental care for children and adults. Exams, fillings, extractions of primary teeth, oral health education. And the value of having that therapist, right, means that we can shift that dentist over to some of those more complex patient cases. They do help to drive the revenue. They're needed. That's the patient care that's needed. So we're seeing a lot more of that in the staffing model, and we're keeping our eye on that as well.
Fascinating. Thank you, Tanya. Whitney, just want to check in with you too if you have any add-ons.
Yeah, so groups that own their own surgery centers are really appealing to many dentists. There's a lot of dentists that have kind of been pigeonholed into these just office only jobs, and they're not spending any time in the OR anymore. Specifically, I've got a large pediatric group in Michigan, and while the location is a challenge, they do a very good job. It presents very well to candidates, and part of that is they own their own OR. They staff that with pediatric anesthesiologists and pediatric RNs, and so it allows the dentist to still work clinically, but then also spend some time in the OR, and dentists seem to really like that.